This is also the front line.
This is our isolation area.
Wren Hall Care Home near Nottingham says 9 residents out of 54 have died with COVID-19, and the staff feel powerless.
Yes, they're living in a care home. Yes, they've got complex needs, but dying prematurely to this virus, and there's nothing we can do to stop it. I mean, I could never imagine being in this situation, but it's tough, really tough.
And the boss of another care home group told us he feels like they're on their own.
We need to have more testing facilities available. It needs to be ramped up, and we need this dialogue with the NHS to give the care homes a clear path.
The statistics are troubling and can be confusing. The daily death toll only relates to hospitals. The weekly figures are more complete, although they come with an 11-day time lag. The Office for National Statistics reports 6,235 deaths in England and Wales involving COVID-19 from the start of the year until the 3rd of April. That's 15% higher than the NHS number, as the ONS includes all mentions of COVID on all death certificates, not just confirmed cases in hospitals. 16,387 deaths in the week to April the 3rd is the highest total since the ONS started compiling the data in 2005. We know the elderly are at the greatest risk, and the charities which represent them say they're being airbrushed from the picture.
At the moment, because there's a 2-week time lag, it's very difficult for us to know exactly what's going on in care homes and more broadly in the community at any given point in time. And that's challenging because it means that we don't have that really good real-time information to make sure that we get the right resources, the staffing, the PPE right, and out to the places that need it most.
And like hospitals, PPE, testing and rotas are major issues. 25% of care home staff are either ill or are self-isolating.
We just weren't prepared. We just weren't prepared.
And if it is ever possible to calculate, we won't know the full death toll for many months. Simon Weiger, 5 News.
Well, today's figures show that over 12,000 people have now died in hospital after contracting COVID-19. Each one, of course, a terrible loss for their loved ones left behind. Shabnam Siddique was a mother of 5 and a local councillor in Slough. She fell ill in Pakistan, where she was attending a relative's wedding. Her fellow councillors remembered her as a young woman with huge determination, known for her kind and caring personality. And this is 68-year-old nurse Liz Glanister. Her family said what they and other families are going through is beyond words. They've said they're so proud of how many people's lives she touched and urged people to stay at home and help heroes like Liz on the front line to be the best they can be. Well, our correspondent Simon Weiger joins us now from Westminster. Simon, a really troubling indication of what's happening in care homes. Can anything really be done about it, do you think?
Well, they're trying to gather more statistics, Julian, but there's always going to be a question mark over the number of deaths. The fear is that it is just the tip of the iceberg. Tonight, the Care Quality Commission has announced that, along with Public Health England and the ONS, they're going to try to collect weekly statistics, not to wait for the death certificates, so notifications from this week from any suspected COVID deaths, and they'll try to get a regional breakdown. But I think it is worth reflecting that somebody dying from COVID is not necessarily the same as dying with COVID. There is a grey area there, especially in care homes, and no amount of stats are going to sort that out.
Simon at Westminster, thank you for that.